Adventist vegetarian diabetics. Prove all things, hold fast that which is good. Rest and sleep. Law of health, number 7. Since the work of building up the body takes place during the hours of rest, it is essential that sleep should be regular and abundant. Ellen White, Education, page 205. There are many types of rest. Jesus said, "Come unto me, all ye that labor and are heavy laden, and I will give you rest." Matthew 11 verse 28. There is Sabbath rest, both literal and figurative. But when we think of rest in terms of lifestyle practices, we probably think of nighttime sleep. What is the particular importance of sleep for diabetics? There is a definite connection between sleep and diabetes, according to sources that we have researched. Too little sleep can raise your diabetes risk. If you already have diabetes, sleep loss can undermine blood sugar control. In one sample, sleep duration and quality were significant predictors of HbA1c, a key marker of glycemic control. Combined with existing evidence linking sleep loss to increased diabetes risk, these data suggest that optimizing sleep duration and quality should be tested as an intervention to improve glucose control in patients with type 2 diabetes. According to one source, sleep deprivation's effect on diabetes is like insulin resistance, which prevents your body from using the insulin it makes. Lack of sleep increases hunger for high-carb, high-fat foods, the worst combination possible for diabetics. In a review of 18 studies, researchers found that a lack of sleep led to increased cravings for energy-dense, high-carbohydrate foods. Sleep disorders. Diabetes increases one's risk for sleep disorders, such as sleep apnea. It's important for people with diabetes and prediabetes to be screened for OSA, obstructive sleep apnea, says one sleep expert. Insomnia, like other sleep disorders, often goes undiagnosed, including in people with diabetes. The increased incidence of RLS, restless leg syndrome, in people with diabetes may result from nerve damage, neuropathy, that occurs with diabetes. When sleep problems are more serious, diabetes is more severe and less well controlled. How many hours of sleep do you need? Does it matter when, in a 24-hour period, you get those hours of sleep? One author wrote, "We often worry about lying awake in the middle of the night, but it could be good for you." A growing body of evidence from both science and history suggests that the 8-hour sleep may be unnatural. Studies have shown that sleeping too long, as well as not enough each night, can increase the risk for diabetes. Can you get too much sleep? The amount of sleep you get, or lack thereof, can make a big difference when it comes to your health. According to a recent study, getting too much sleep is just as bad for your heart as not getting enough. Ellen White has been reported to have said, "The number of hours of sleep generally needed varies with circumstances. The average is 7 to 9. In general, one should sleep when sleepy and not try to sleep more." It is said that if you need an alarm clock to wake up, you are probably not getting enough sleep because, if you were, you would wake up before the alarm clock rings. One writer said, "If you can find a way to match your sleep schedule to your biology, and get a full 8 hours of Z's, you'll be better off." Current research suggests that the average adult needs between 7 and 9 hours of sleep per night to feel rested and prevent the symptoms of depression. Experts recommend keeping the same bedtimes and wake times every day, even on weekends. The average sleep requirement is 7.5 hours of sleep, but your requirement may be as little as 6 hours or as much as 10 hours. Whether your body needs 6 or 10 hours of sleep, make sure you get what you need. The following may help to promote better sleep. Keep your blood glucose under control. Normal equals 70 to 99 mg per deciliter or 3.8 to 5.6 millimoles per liter. Make sure your bed is large and comfortable enough, and pillows at a comfortable height. Ensure your room is cool, around 18 degrees centigrade or 64.4 degrees Fahrenheit, and well ventilated. Have your room dark and free from noise. If this is not possible, you may benefit from a sleeping blindfold and/or earplugs. Incorporate a period of exercise into each day. Stick to a regular bedtime. One researcher posits, if you're a middle-aged adult with high blood pressure, type 2 diabetes, or existing heart disease, and you typically sleep less than 6 hours each night, you could be setting yourself up for cancer or an early death from heart disease. Best sleep before midnight? Every hour of sleep before midnight is worth 2 after midnight. Your grandparents and great-grandparents probably adhered to that creaky adage. The mythology is unfortunate, because there's no pumpkin-like magic that occurs, says Dr. Matt Walker, head of the Sleep and Neuroimaging Lab at the University of California, Berkeley. He says that non-REM sleep dominates your slumber cycles in the early part of the night. But as the clock creeps toward daybreak, REM sleep muscles in. That's significant, because some research has suggested that non-REM sleep is deeper and more restorative than lighter dream-infused REM sleep, though Walker says both offer important benefits. Apparently, James S. White wrote, in Health, or How to Live, 1865, 1 hour of sleep before midnight is worth 2 after it. Actually, there's nothing magical about midnight on the clock that makes every hour of sleep before midnight worth 2 after midnight. But here are some sources I found on this topic. Dr. Sarah Myhill, a medical practitioner in the UK, in her article on CFS, chronic fatigue syndrome, wrote, in 2007, there are some lifestyle changes which have been well recognized to improve production of HGH, human growth hormone, the most abundant hormone produced by the pituitary gland and is the most important anti-aging hormone. The first of these is sleep. Most secretion of HGH occurs during the hours of sleep before midnight. This may explain the old wives' tale that 1 hour of sleep before midnight is worth 2 hours after. It squares with the fact that many CFSs are owls rather than larks. She further states, the second factor which affects HGH production is diet. Insulin blocks HGH production, so anything that can be done to keep insulin levels low will be very helpful. Again, this may explain why the low carbohydrate, medium protein, high fat, ketogenic diet benefits so many of my CFS sufferers. And that, for us as diabetics, is very significant. Another author connects circadian rhythms to sleep quality. There's an area in the brain called the circadian timer which helps to synchronize the movement and function of every cell in the body to the levels of light and darkness in the environment. So as the light level drops below a certain limit, it sends a message to the pineal gland through the eyes, and then every cell in the body starts adjusting its functions. Our circadian rhythm plays an essential part in the regulation of many of our body's systems, including our blood pressure, body temperature, and hormone production, think HGH. The 90-minute phase before midnight is one of the most powerful phases of sleep, because it's the period when the body is replenished, Dr. Narina Ramlakhan, a sleep expert, explains. It's rejuvenated on every level, physically, mentally, emotionally, and, I believe, spiritually, as well. There's a lot of healing that takes place in that first phase of sleep. She continues, it's also a really important phase for reorganizing the brain. So all the information we're taking in during the day gets reorganized during that phase of sleep before midnight, and it's very important for bringing adrenaline levels down. If you're under a lot of stress, you want to make sure you get that phase before midnight. Melatonin. Melatonin is mainly produced by the pineal gland, and, although it appears not to be essential for human physiology, it has a range of different effects when taken as a medication. Many people take a melatonin supplement as a sleep aid. However, Studies show that melatonin might decrease glucose utilization and increase insulin resistance. Researchers have discovered that increasing levels of the sleep hormone melatonin reduces the ability of insulin-producing cells to release insulin. Acute melatonin administration in humans impairs glucose tolerance in both the morning and evening. Another writes, low nocturnal melatonin secretion levels are associated with an increased risk of developing type 2 diabetes. One article gives all the reasons melatonin supplements can lead to higher blood glucose levels and ultimately greater risk of developing type 2 diabetes. I cannot take melatonin. It was when I had a nearly full bottle of melatonin that I discovered it skyrocketed my blood sugar, so I gave it to my ex-husband. He's not diabetic. Even if melatonin does not raise your blood sugar, and if it helps you sleep, you still should consider it a temporary fix. If you take a melatonin supplement all the time, your body will eventually stop making it. Visit our website at AdventistVegetarianDiabetics.com. Follow our blog at AdventistVegetarianDiabetics.com/blog posts. Subscribe to our YouTube channel at youtube.com/AdventistVegetarianDiabetics. Copyright by Adventist Vegetarian Diabetics.